Good evening, everybody. Welcome to the Board of Health meeting for October 20th, 2020. The agenda that we'll be discussing tonight is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. With that, I will ask if there's anyone out there for citizens participation. Mark DeSoni, go ahead, you have the floor.
Okay, thank you. Good evening. This was not previously prompted to ask, but we'll ask it anyways. Seeing how the COVID virus is out there and can be contagious and be a super spreader at times, I'm asking on my own, it is on my birthday. How is Halloween going to be handled in this town? It is my birthday, seriously, October 31st, 1956. I'll be 64 on that day. So I want to know how my day is going to be handled COVID-wise. Thank you.
So does anybody want to discuss the part of Halloween that we want to talk about that maybe isn't part of the COVID conversation, or should we just leave it all for the COVID conversation?
You could probably suggest that this will be answered in the COVID conversation period.
That's what I would think.
Okay, Mark. So there is going to be some discussion about that during COVID. And at that time, if you have a specific question that you wanted answered that wasn't answered, we'll let you come back on and ask that question during that time, okay?
And if he has any other questions for other than this, he can ask now.
Mm-hmm. Diane, you look like you're just about ready.
I am. I apologize. I'm late.
Okay.
All right, we're counting. The penalty book is going up now.
I'm just excited
deduct
to
it
have
from
gotten
my
my
salary.
Yes, we will. We will.
All right. So, Chris, you also have citizens participation?
Yeah, citizens participate. Anyone else for citizen participation? Okay.
Okay.
It's all yours, Di.
All right. Thank you, Chris. I appreciate it. Ed, you want to start out with COVID updates?
Sure. So I just want to make everyone know I've asked Amy Childs to join in today. She'll have some feedback with some things that we've been working on also. So I do want to let everybody know that we now have 2 remote learning enrichment programs that have been approved. One, obviously approved by us and the state. One is at the rec center run by Kelly Rund. They are licensed for 26 participants on Monday, Tuesday, Thursdays, and Fridays. That is going really well. I was actually also able to work with Lisa Bowden at the school department. So we're actually serving breakfast and lunch through the school department to those participants at that program. The other program that was approved was Beyond a Classroom, which is at a residence. We did ask the fire and we had Captain Morahan from the fire department went out there to make sure we were fire compliant and building codes compliant. And they were also approved for 6 students on Monday through Friday. I actually paid them a surprise visit today because that's a requirement that we do unannounced inspections of these programs. And I'm happy to say they were in full compliance, and I did forward the board this afternoon a quick report on that. Does anybody have any questions on that?
Is that address a public knowledge, or is that a private lamp?
It's a private home, so I don't want to give out the address.
Okay.
Our testing machine is up and running, everybody. We are doing PCR testing for town employees that think either they've had an exposure or they are sick. We went live on October 9th, and to date, we have done 27 tests so far. Just letting everybody know that. I did want to talk about, and this will lead into our discussion about Halloween and other town events. Sorry. So preliminary numbers for Wednesday's data that comes out from the state tomorrow at 6 p.m. If I am correct, from what I'm looking at my numbers, we will have 20, and again, that's a 14-day look back. So the state in our numbers for tomorrow are going to be looking from October 4th through October 17th. That's the 14 days. So if I did my numbers correctly, they're going to show that we had 22 confirmed cases in that time period. And if I did my calculation correctly, that would put us at 8.14%, which the yellow is 6 to 8. Anything over 8 is going to put us red. So that 0.14% most likely is going to put us in the red starting tomorrow. Now, in that same time period, though, we have cleared quite a few cases, and we do have new ones, obviously, that have come in. Now, the other piece that I just want to, what I did was at that point with the 22 cases, I really wanted to break those down. 10 of the 22 cases, so almost half of the 22 cases are in 4 households. So I just want to show that it's not a big community spread. It's very concentrated. Almost 50% are in 4 households. So again, I think this is a good point to start bringing up a discussion with the board. Yes, people are going to, obviously tomorrow, if we do go red, they always tell you, look at your data. Don't just look at the numbers. And that's why I'm breaking it down that way. We don't have an issue in our schools. That I really want to point that out. This is not a school-related issue. We do have a couple of small cluster events that we are working that are creating these numbers, but we as a community need to make decisions about other outdoor events and things that are going to be happening in town. Again, we just can't look at the numbers. We have to look at what we have, what that data actually looks like. And I actually feel we are still in pretty good shape, based on the way I've come down with the numbers. And, Amy, do you want to just kind of chime in here a little bit on kind of what you're working on?
Sure. Any specific? I don't know how specific you want to get within this forum.
Just that you're working on a cluster and it's
Sure.
concentrated with,
so there's a cluster that involves 18 individuals who are together for an indoor dinner party that then traveled together. Of those 18, there are 5 households involved. All 5 households have so far have had at least one person come back positive, and in many cases, it's multiple people. So it turns out that this cluster, where we thought it began, the index case actually went back a few days prior, which could have affected a much larger group. So I've reached out to the individual who's in charge of this group. Can I say that it's related to it? Nope. Okay. Nope. Nope. We're good. So we're trying to do more testing based on that, but it does affect a wide range of ages and kind of backgrounds. I just feel like at this point, as Ed mentioned, there are just 2 clusters that we've been working on. However, they are from very different demographic standpoints. So with that being said, I feel like we really need to do a much better job on educating the public at large. As we all know, there hasn't been a lot of federal guidance as far as what to tell people. The state, it's kind of variable. And actually, I have worked with a local primary care office in the past day, where I found out that they're giving incorrect information, not only on testing, but on what quarantine and isolation look like, to the point that I needed to speak to the DPH today. So I feel like we need to do a better job in terms of public outreach on social media. If somebody, not throwing Ed under the bus by any means, have an interview with Yolanda, just to have more public visibility within WACA, social media, the website. Jim and Michael are sending out great updates in terms of email, but I feel like we have a lot of email coming through.
Yeah, and that's part where, so last week Judy was working on, with Kitty, trying to get more information, and then Amy actually came up with some information too, which I actually sent to you today, Judy. I'm not sure if you got it or not. I sent you an email early this morning with some more suggestions. You're muted.
Judy, can't hear
there you go. Yep.
I started, so Amy, glad to hear we're on the same wavelength here. Last week, it was brought to my attention by quite a few mothers of high schoolers that nobody really understood. What does it mean to isolate? What does it mean to quarantine? Why, if that family's quarantined, why are those children out? So basically, I started a Q&A, sort of a frequently asked questions sort of format. I sent it to both Ed and Kitty Mahoney at Framingham to say, hey, look this over, answer these questions for me. Both communities could probably use it because there's a lot of bad information out there. We need to be more proactive. I think like everybody that goes into vote should get this Q&A. Like it's just not known what these things mean. So I can send it to all the board members. Tonight, it's probably 90% there. I'll include you, Amy. I know you have a list, so if you want to look at this one and sort of merge some of yours in that I didn't have in mind, I think the more information we can get out there, the better. It also suggests that we do a Q&A session on cable and maybe get this kind of format to the superintendent so he could make it readily available to all the parents. The town manager sending a link. It was very eye-opening how many people don't know what to do when they're in this situation.
It's true. So I don't know if you had fully read what Ed had sent, but so I posted this basically Q&A with things that I've been frequently asked. So I actually work full-time in a primary care office, so I'm pretty busy during the day. And I was, between the two clusters over the last 2 weeks, I've been inundated with questions and it seems repeatedly to be the same question. So I said, let me just put it out there and see, who needs this information. And the feedback was incredible that so many people weren't aware. I heard from nurse practitioners at various other offices. I heard from people in the pharmaceutical industry who were not aware of any of this. And of course, our own community members. So I am happy to share this information. I mean, we're inundated with it as far as Ed and I. It's just there's no good way to get it out in a timely manner. So I feel like a lot of people are looking on Facebook, Twitter. I don't know if Beth handles that, but even if we could make smaller chunks of that information and make it available instead of like one big document, just so you can pick and choose what you need to know, and then have, if we can encourage people to send questions to the COVID email line, or even if there's a separate division of the COVID email, just so we can compile these questions and, once a week post the answers and have an ongoing discussion, because I feel like we're in an okay position right now. But I feel like that could change so quickly. And I want to do everything in our power to preserve, school and everything else that's going on. My kids are remote right now just because over the summer, seeing where things were happening, I was leery about sending them. I desperately want them to go back in January. And I feel like we have an opportunity right now to be proactive and get on this and make it more known as to what the symptoms are, because there's so many people who have no idea that what they're experiencing is actually COVID. They don't know where to go get the testing. Even several physicians' offices aren't doing correct testing. So they're very simple answers that we just need to be able to push out quickly and easily.
Sorry.
The other thing is there was a friend, someone that I know, who was told by her doctor she was positive, and she could just go home and carry on as usual.
That is what I'm hearing. That
doctors was told of that. So who am I to doubt the doctor?
I can imagine what office that was.
So
they're not up to date on the information, because I feel like primary care is handling so many other issues. They're not on top of what DPH is pushing out. And I do know of offices who are telling people go home and quarantine, but they don't realize that actually means isolation, and at what point they need to be tested, and how, what's a isolation versus quarantine. So
well, I just wanted to I wanted to add that even on the news lately, they've been talking a lot about, especially with the holiday season coming up between Halloween, Thanksgiving, and the Christmas holiday, is people getting together for immediate families, because they're telling people to have that plan. If you need to do an isolation or a quarantine at home, you need to know what you need to do.
Well, and that's the thing. I feel like people need to make well-informed decisions at this point. So, you know, I've heard a lot of people say, oh, well, we're safe, we can do X, Y, and Z, and I'm only with this person and they're safe. And like, what does that actually mean, safe? Like, it's nothing tangible. So
I think we also should emphasize for the people, because it seems like even the people who are sick are not following. They know what they're supposed to do, they're just not following it.
Right.
So, I mean, I know it's probably a larger problem than us sitting here,
Yeah.
but that concerns me that somebody who knows they're sick is still not following the correct rules. So, and maybe, like you said, maybe putting out there that the COVID hotline is available, the COVID email, if you have questions, call, whatever, and maybe just re-emphasize that, because it has been since March. So maybe we just re-educate people that, you know, there's somebody there to answer the phone.
yeah.
So what if we, you know, just as a suggestion, and, you know, Judy, you know, chime in here, please. You know, what I was thinking was if we could have Ashley and Beth every day push one question out, you know, on our Facebook every day, push one question out, but then also have a link to all the other questions. And every single day, Monday through Friday or 7 days, just have it go out first thing in the morning, you know, with one of the bullet items, but then also have the link.
I mean, you know, I mean, obviously the board members can chime in, but I think you guys can work out those details outside of a meeting, because I think obviously everybody sitting here will absolutely support what you're doing, because we need to get that information out there. So
Right. I think KG has a question.
Oh, many questions, unfortunately. And let me first thank Judy for bringing this issue up there, and for Amy and Ed and Judy to work on this one. I'm sure you will probably come up with the right answers and right methods to publicize this and help the community. But the cluster, when was that designated as a cluster event?
The one that I'm covering?
Yes.
That would have been
October 7th, Amy? Or that weekend. Yeah, well,
that
right.
weekend. So KG, there ended up being several events that transpired. So there was a gathering on the 7th with an individual becoming symptomatic the following day, and then the entire group traveled
right, but
all together.
You were notified. When it was apparent to the board, or when it was apparent to Ed or you.
Goodness,
that is when the time it counts,
Tuesday.
but when it happened,
Right,
it's
you're
different.
on mute.
I know, we're all over the place here, and of course I have dogs barking in the background, so I apologize, but let's try to just like pull it a little bit together. So we're gonna do the Q&As. We're gonna put together, sorry.
So that
it was apparent last Tuesday into Wednesday.
Okay, so
but it had initially occurred the following or the previous Monday.
I didn't know whether I received an email on this factor exactly on this one. I don't think I did. If I did it, I might have missed it anyway. So that's
no, KG. That would be like a whole HIPAA thing. We can't give out any of that information.
Not even just
let you know that we have the cluster.
Oh, that's what we needed to know.
Yep.
Okay, that was it. The other question is that I know that I heard you coughing and sneezing and stuff like that, but how well are you? And is there a standby for you if you get sick? We have a standby.
Yeah, Amy.
I didn't know, but I just wanted to make sure that the board is aware of it.
Don't forget Mark. I was going to say, Mark's down in my left corner. I was going to say, don't forget Mark. He's quiet, but.
Yeah, he's quiet. It's all right. The other question is, have you gotten tested yourself, Ed?
All right. He doesn't need to disclose if he's been tested. I'm sorry.
Oh, okay. So
sorry, Chris. Hold on, Chris has a question. He's been patient.
No, I have one more question. Let me finish it. But the question is, if he's delivering or he's going and inspecting people, that how well he is going to make sure he's all right to do that? It doesn't transmit it.
So I'm going to speak for you, Ed, because I mean, he's going to take every precaution, just like all of us sitting here at a meeting or the general public. So he's protecting himself every single day, just like the rest of us are. But obviously, if he has symptoms and can't come to work, I mean, he would obviously rely on Mark and Amy or anybody else who's doing any assistance.
Okay, as long as I'm guaranteed that.
He has access to the COVID test, so he can do that if he did.
Yeah.
Chris,
And
go ahead.
the test that is being done only for people who wanted to get it done, or people who have some possible symptoms? The one
So
that you did.
So what we're doing is we're doing it for town employees that have become with any COVID type symptoms. And we will also use it in the event a town employee feels that they had a potential exposure.
Okay.
Good.
Thank you.
So in the spirit of this conversation with getting information out, the first roadblock is making it easy, to get information. Like I just went to the Ashland, Mass website. And when you go to ashlandmass.com, it takes 3 clicks to get to the actual coronavirus page. And if you can actually get to it in 3 clicks without knowing how to do it and figuring it out, I applaud you. It's actually really buried. So the only way to get to it directly is by putting in the full link, ashlandmass.com/765/coronavirus2020. So what I think needs to happen, the first thing that needs to happen is I think that when someone clicks that coronavirus info link up at the top left on ashlandmass.com, it should go straight to this page and not to some other page with a bunch of information that doesn't mean a whole lot. It should take them here because this is what people want. And then I think the next thing that we could do with this page is all the information on it's great, but I think there should be a giant button somewhere very obvious with an FAQ page or whatever you want to call it that would take them to that page with the questions that you're all discussing. And then lastly, go ahead, Ed.
Sorry, Chris, I'll get with Beth and Ashley in the morning and ask them to do that.
Yeah. And then the last thing is to Ed's point about pushing stuff on social media, there's a great little box there that says Town of Ashland Coronavirus Hotline, and it has the hotline phone number, the email address, and the website address. That should be right on the social media page. That box, it has everything everybody needs to get them the information that they need. And that's my 2 cents.
Tom, did you want to say something? Oh, go ahead.
Yeah, Diane, I know you wanted to know Tom's presence here. So Tom, if you can update the board, I think Ed and you were working on a case.
I just, thank you, Mark. I just wanted to, based on what Chris was saying, when you get that website, I put the website in my actual email signature. I think it might be a good suggestion to have all town employees to put that website right in their email signature. I know I do that in other communities that I work in, so just information kind of gets out there. If people haven't already, I don't know. I'm not sure. I can't speak for anybody else, but that's what I've done.
And I don't know, I don't know if the site I sent in the chat session is the most helpful link, but it is an FAQ from the State Department of Public Health.
Yeah, and what I think, the conclusion of the conversation, I mean, that's great, but people aren't going to go through those channels to look at it. We need to make it, hey, here's the information per day. Hey, did you know this? Hey, did you know that? I think it's a healthy discussion to put actual context out there, especially with everything that's been going on lately. So
you can always add a line saying that additional information, you can find it somewhere else and link that one if they want to.
Well, and I think we should reiterate that, I mean, clearly staff is here to help and answer questions
That's right.
of whatever nature. So
that's right.
Yeah.
So just to circle back, who will be in charge of publishing this information and then posting it?
That would be Beth and Ashley.
Okay, I just want to make sure that this isn't something else that's falling back on you, Ed.
Nope.
So I'm going to jump in for a second. So I have the master document that I started, the FAQs. I saw yours today, Amy, so I haven't had a chance to go through and see, I don't have that one. I'm going to put it in this heading because I kind of did it by quarantine, isolation, contact tracing, it's like under categories. So I want to take some of your stuff and merge it in, and then I'll give it to Ed to, work with Beth and whoever you just said. But in the meantime, I'll send what I have out to everybody so that they can see what we're talking about.
Okay, sounds good.
Knowing that it's a work in progress.
I do feel like, I know that we're not at Halloween just yet, but as we prepare for that, possibly that should be the first information going out as far as how we're going to prepare for that. Alternative suggestions if they're not trick-or-treating, and of course the suggestions for how to make your trick-or-treating more safe. So I feel like I'm getting a lot of questions about that and what my plans are and general thoughts on how to proceed. So I feel like that should be really forefront at this point.
Okay. In the FAQs, you mean, or?
Yeah, so I mean, if we're going to do a daily post or some,
okay, you
know, combined post, that it needs to be on the town Facebook page, on the Ashland Bulletin Board, which I know that's a brutal place to put anything. Instagram, Twitter, anything where it can open up dialogue, which again, we'll see how that goes. But just to get good ideas out there, because realistically, people are going to do what they want, as we have seen all year. And I do think
we need to be careful if or what is reposted. Like if somebody posts something, because as we know, some comments are not appropriate. I want to make sure that we don't have dialogue that's inappropriate, for obvious reasons. But I think we should talk about Halloween. I mean, I don't know if Ed, you want to segue in, or even
so Amy and I have had some interesting discussions about this. You know, you obviously saw Worcester and one other community are not going to have Halloween, but there's only been 2. But then, we were talking about it. One of the concerns is if we didn't allow trick-or-treating, are people then going to have, quote, Halloween parties at their house? And now we have this congregating issue, which we don't want to have, obviously. Or do we just, do we encourage, if you're going out trick-or-treating, giving all the safety, you're going to have a mask on, you're going to, obviously we're going to ask anybody that's potential, in our notes, we could say anybody that potentially is sick in their house, please don't have your lights on that night or whatever, so people don't come to your house if you're sick, different things like that. But again, it's a discussion with everybody. There's pluses and minuses, like with anything we do.
I'll start off by saying that not having children, I've talked to a few parents just to feel people out to see what their thoughts are, their feelings, and so forth. The couple of people I talked to actually have like a plan B, and that's what I'm hearing is if the town cancels it, or I'll say, doesn't recommend it, that people have a different plan, and it's neighborhood gatherings or whatever type of a gathering on a private property. And that's concerning to me. I did read over the guidelines that Laura, I guess it was Laura that sent to us about the safety tips. And I find it a very resourceful guide because it gives people alternatives to, if they don't want to do the traditional trick-or-treating, of different ideas that they could do that are safe. So that's my comment. Chris?
I don't know, a couple of years ago when the expression "we're canceling Halloween" first came around, I don't know how long ago it was, but it wasn't all that long ago that people decided to cancel. And I thought to myself, how can you cancel a day on the calendar? It's kind of strange. I think what we're really talking about, and only because it irks me to say we're canceling Halloween. We can't cancel a day. We can make guidelines as to whether or not it's safe or not to do the traditional things that people do on Halloween, such as trick-or-treating. I live on Corderville. I've lived in this house for 18 years, and I've never had a single trick-or-treater at my door because it's not a good place to trick-or-treat. It takes too long to get down my driveway and then to the next house. But when my daughter was a kid, we'd go up in the Oak Hill Apartments. You score in about a half hour. You score 2 bags of candy, and you're done. The problem with places that are conducive to trick-or-treating the traditional way is it's normally done in groups that are unsafe. So the question is, can we really tell people they're not allowed to do it? I guess we can. I guess technically we can say, it's illegal to trick-or-treat in this town and hand out citations to parents, but do we want to do that? I think that your point of offering safe guidelines is something that makes more sense and you know, I'm open to anything because I can't in my head imagine how to word it or how to present that information to people in a way where it makes sense to them. But I think that's the right thing to do, is to make it as safe as we can.
Right. And I think if we issue, you know, if there's a way to put out, you know, the safe guidelines to trick or treating, and, you know, again, on our website, you know, social media, you know, a few days before, so people see it. These are the recommendations.
Even the guidelines that that we have as part of our agenda tonight, I mean, it does talk about even people who are putting out candy, you know, maybe to have hand sanitizer there. You know, I mean, I'm just looking at it here. It talks about, you know, actually putting candy and having hand sanitizer there. Of course, wearing a face covering. Keep your hands away from, keep your hands away from your face. So there's different. Obviously, I say it's similar to, we have early voting at the town hall, and we have a lot of people coming in and out, and obviously everybody has to, you know, keep their distance, protect themselves. And the same thing is, I mean, if people are handing out, you know, candy outside, that people are not touching their doorknob or going into their home. So, I mean, I think there could be modifications that people could make individually if they're participating in called a traditional handing out candy, you know, handing out items. So, Ron, did you want to say something?
Yeah,
I'm sorry.
That's so most of this, at least from what I'm hearing, and I like the point that you just brought up. That's what I want to bring up, maybe to piggyback a little, you know, with Chris, is that all of this seems to be focusing on the kids and maybe the parents that are going to trick or treat. What about people like us? Like, I have at least, there's 150 kids in our neighborhood. They come in packs of 8, 10, 12, 4, 2, 6, from little kids, you know, that are babies that their parents are bringing them around, and then, you know, middle schoolers and high schoolers that are coming in groups. You know, it's to Chris's point, it's a great neighborhood. There's 45 or 50 houses. You can walk it. What about people that are older that don't want to necessarily be exposed to all these kids? Because you're talking about it from the kid perspective. What about people that, you know, I don't.
And, you know, and the reason why I was driving that point home is because I think, again, reiterating what adults need to do.
Right.
I think it's a little bit harder. I mean, again, not having children, but I think it's a little bit harder for the younger people. They forget, their mask falls down, they're touching the face, but they're touching all different things. Right. But so, I agree with you, Ron. I mean, I guess that's a personal choice. You know, if you
I'm going to feel like
you didn't have to participate.
Turn my lights off and say,
right,
I'm doing this because, I mean, normally we get 5 big bags of candy from BJ's, gone. Right. But, you know, so am I going to put it out on a table and then have these kids wiping their nose and pick? I mean, how does that get mitigated?
So here's the thing about that. I had talked to Ed about it earlier today in terms of, you know, looking at it from both angles, because I take care of a huge population of older adults. I also have 3 young kids of myself who have been harping on me about Halloween since the school shut down. When we push out information, we need to give options for both circumstances. So tell the families how to do it safely. So, you know, we're used to going in a group of 12 kids. If we do it, that will not be happening this year. It should be a group of like maybe 1 to 2 families at most, because you don't want to be packing the kids on the doorsteps, on the porches for their own exposure or the house owner's exposure. You know, we need to make the communication about this light as possible, just because that's how you're going to draw on people to actually read it and then get them to take it seriously without causing any kind of political conflicts, because that's what it always goes back to. So, you know, give options for what the costumes could be. A ninja has a mask. I've seen a variety of options on Etsy. Crayola has great, you know, Frankenstein mummy masks that would be great with.
I noticed that in the guidelines as well. They were saying, especially for the younger ones who want to participate, you know, that again, the mask might not be, you know,
and Ron,
to make it part of the costume. Yeah, and they're also suggesting even putting out trays of candy versus bowls of candy. I mean, the guidelines.
I'm sorry. I was recommending to some of my patients, you know, who, Ron, to your point, I understand that this is just as exciting for adults who get to see these kids go out and enjoy it. And it reminds you of when your kids were young. So, you know, making up individual bags to leave out that you can sit out there and see the kids come up and do their thing. But it's already prepackaged. They grab it and go. I wouldn't recommend the hand in the candy bowl, but there you go, Chris. Incorporate an Inspector Gadget costume. I mean, we've got options here. But yeah, avoiding gathering on the doorsteps, avoiding big groups, keeping it small. And for families too who don't want to trick or treat, I think we should provide options for that. So I've seen glow in the dark, like Easter eggs that you fill with candy and do a candy hunt in the backyard, having an outdoor movie night, making a fort and staying inside. I mean,
they also talked about doing like virtual pumpkin carving for the, for the kids.
Yeah.
I mean, I think that's a great idea as well.
My only concern is that, we've done a lot of outdoor activity over the summer when the air was hot and humid, and we know that for airborne transmission, that is not ideal. So I feel like that had a lot to do with where we were in terms of infection rates over the summer. As the air is turning colder and drier, that is more favorable for viral transmission, which is why we see the flu rise in this season. So I don't know where we will be at by October 31st and where our risk level will be in terms of transmission with airborne particles. So, I mean, really driving home the masks and not congregating in big groups. And if you are outside at a backyard gathering, because realistically, we know that those are happening, just really pushing the mask use because we don't know what it looks like in terms of the air transmission at that point. So
what I didn't see on the DPH guideline, unless I missed it, is should there be something about, now when the kid has this bag of candy at home, that maybe that bag of candy, they shouldn't be dipping into it, because if the candy came from a home that was infected, that maybe has some germs on the candy, that maybe it should sit for whatever period of time for the virus to die.
Here's the thing, is that the fomite transmission, in terms of contact transmission, there's very little evidence for it, to my knowledge. That's not how most of this is being transmitted. It is by and large droplet and airborne, which I feel like also people don't understand the airborne transmission that I have said. Think of it in terms of, cigarette smoke, where it's profuse in the area around you, but you certainly can see, trails drift off and reach much further distances than 6 feet. Of course, we don't know what volume of virus is needed from that further trail to infect somebody, but that's something to consider. As far as the contact transmission on the candy, by the time I think kids would get home, anything that was on there should have kind of died off. I mean, it's not going to last long without the favorable conditions of, I think it's 68 degrees. Sunlight would help too, but I don't think that's going to be as big of an issue. If you can get home, make sure you wash your hands really well. Do you want to Lysol the candy? I mean, up to you. I don't think I'd be doing that, but it's certainly something to consider. I'm not overly concerned about, the contact transmission in that capacity.
Well, I think even putting out, I'd say the COVID task force, we could reference the Board of Health, but I think putting out facts and information like that, I think people will appreciate it, and they'll appreciate it now, because I know some people are struggling with what they should do, because of course the kids want to do it, the parents are not too sure, but I think if we can get information out there and just educate people as best as we can, and have everybody just do the best they can for their immediate family.
Yeah. That's the thing. I feel like if you give the people information, they can make educated decisions for themselves. And it may look different for different families, but at least we know that we gave them everything we possibly could to decrease the risk of this and make it as normal and safe as possible given the circumstances. And also focusing back on, this will not be forever. This is not how Halloween going forward is going to look. It's just the crappy circumstances of this year. So every conversation I have, I'm trying to go back to, this is not what it looks like indefinitely. So
right. Well, thank you for all of that information, because it's eye-opening for me as well. So I appreciate it. Ron, did you have a question?
Well, just a quick comment or question for you, Mark or Ed. Has there been any conversation with either Mike or the Board of Selectmen? Are they weighing in on this as well? Or are you not?
So I had a conversation with Mike, just like in passing, and Mike's like, he can't see canceling it, but I will tell you, the phone calls I'm getting, it's 50-50. Like, I had a gentleman call me today, you guys have to cancel that. And then, 2 minutes later, I have a parent, is it on? I said, well, as far as I know, it is. It's going to go both ways. There are definitely people that don't feel that it should happen. And
the good thing is people can make a choice at their home, what they want to do, whether they want to allow trick-or-treaters to come to their home, or allow their family, because some of them are not so young, but allow their family to go out trick-or-treating, because at least we can give them all the information that's been shared here, and they can make a decision, because let's face it, everybody's going to be different. And like I said, in Ron's neighborhood, he doesn't want to be that guy with his light off, but if he feels safer, he might choose to do that.
I think we should probably provide them enough safety measures and instructions for being safe, because we are allowing people to congregate in the school with whatever the limitations they're putting it in, as well as we are going to the shopping. So we shouldn't be curtailing the other activities that they want to do, and then keep themselves free of worrying about this COVID all the time and then sitting in one room.
Right.
I think one of the main themes.
Sorry.
I think one of the main themes we're hearing here is preventing large gatherings, both youth and adults. I think that you'll look into when you look at the DPH guidelines, that's one of the first things they say to avoid. So maybe that's one of the first daily informational items we can put down there, is to prevent social gatherings of large proportions. I mean, it was mentioned.
And specifically indoors. They don't want people to go.
Yeah, but as long as they maintain the social distancing, that's fine.
Yeah, there's some limitations outdoors and indoors, but I think, again, I think Ron mentioned it, he sees all various types of crowds. So I think one things we want to emphasize is the crowds and preventing large crowds. That would be my input on this.
Maybe we could probably suggest that each individual families take them rather than congregating together and going with multiple families as one unit.
Well, I think that could be one of the strong points, if I say it that way, is to put out there, because I mean, the information that we do have in front of us tonight that was provided as backup, it does say to prevent indoor functions, I'll call it. So, I mean, even if you did go to somebody's house and you wanted to, just have a social distancing outside instead of indoors, those things that we can just remind people. And again, because it's not that far away, is just keep doing it over the next, week and a half or something, and make sure that we get that information out there. And I think, and I really do believe it's an individual decision, whether it's the homeowner or the parent. But I think the information tonight, I think, is very valuable to the general public. And I think if we get it out there, people will appreciate it.
And also, if we're talking about large group gatherings, I just want to point out that our 2 clusters happened because there were indoor unmasked gatherings. So I can't drive that home enough. I know people are going to be getting together indoors, but I feel like when most people think of a large group gathering, they're thinking of some, large party. Really, it takes 3 families of 5 to create a cluster. So I feel like we need to be more specific in what we mean in terms of large group gathering, because it can be just a couple families and that can turn into an issue. So, and again, especially as the air, temperature and condition changes, as we turn on the heat inside and that's blowing air around, that's going to change our circumstances and make things, potentially worse.
And maybe if we come up with 3 or 4 major points for trick-or-treating, what we could also do is I could ask Jim Adams to push that out in his night, in his email that he sent out to all the parents, that night, that afternoon, just so that all the parents in the district have the late, 3 or 4 highlights that we come up with.
Mm-hmm. Judy, did you have a question? I know you had your hand up.
Thanks. So what I'm hearing is we're not in the, we're not sitting here trying to decide whether to cancel Halloween or not. So Halloween is Halloween, and really it's an individual choice. Everybody knowing, if you don't feel comfortable, keep your light off. And if you do, I think everybody on Ron Street should have a 6-foot PVC pipe to just shoot it down into their bag.
I'm just going to make individual bags.
Yeah, that's a good idea.
Because it's
that's a great idea, Ron.
The kids, I think, are, I have a couple of grandkids in town, and if Halloween was canceled, I think it would just put them over the edge.
But also,
As
even
long
if
as
we,
it's safe.
Yeah, I
If
will
we
call you
cancel
that
it, people
Judy was
still do it.
responsible for it.
Amy, were you going to say something?
I was like, I mean, canceling it just seems off the table, because even if we like formally cancel it, neighborhoods are going to do what they want. I mean,
And
my
it's gonna
neighborhood's
be
already
worse.
asked if we'll come over.
We won't be able to control it, so.
No, we can't control anything. So, but I mean, you know, with our elderly neighbors, we have, or actually they approached us to see what our plan was and what we wanted to do. So ultimately we said, whatever you're comfortable with, we're happy to bring the kids across to, you know, so you can see them. I don't know. We'll see what our night brings at that point, based on where our cases are at. So yeah, but I mean, making a conversation with your, you know, older neighbors ahead of time just to see what they're comfortable with. Also, we don't know people's comorbidities, what they're experiencing at home in terms of any immunosuppression. So just to get that out there.
Right.
You know,
And this might be a really odd thing to say, but both of you are dealing with a lot of people, a lot of cases. And of course, please, you just remind them that if they're quarantined, don't turn your light on. Because I really have found that since this has happened, some of the stories that I've heard about people that are sick and they're going to work, or let's face it, jogging or whatever, like there's some people that are not following the guidelines, even though they're the ones that are sick. So I just want to just reiterate to them, if they're the people that are under quarantine or not feeling well, to do the right thing and just don't.
I really think we have to push, like, whatever your comfort level is. Like, we're not telling you have to have Halloween. If you know whether you should open the door to strangers or not, and expose yourself. So
I know, I just think we need to reiterate it to some of the case.
Oh, we're gonna have to drive it home on a regular basis up until 7 o'clock on Halloween night.
Okay.
But yeah, I mean, we can do the best we can. I just feel like without giving a sufficient amount of information pushed out consistently on every platform possible, we will be doing the town a disservice. I feel like we could be a model for other towns in terms of how to handle, trying to keep some sense of normalcy with traditions going forward and being smart about it. So
yeah, I agree. Do we have anything else for COVID, by the way? Circling back to.
Yeah, I think that's enough for tonight, isn't it? I can come up with some stuff.
I have one.
If I
One
can,
quick one. When you
Tom
said
was
we
on
may go
already.
to
Oh, hold on one second. You guys are talking over each other. Sorry. Hold on, Mark. I'm just gonna. Judy, go ahead.
when you said we're going to red tomorrow, and I know we have to look at all the facts, does that mean schools get canceled and we have different criteria? Okay.
No, so DESE, just so you know, DESE does not deem when a community goes red that schools go all remote.
Okay.
We look at the data, and again, that's why I strip it down to find, right, because right now, none of these cases are involving our schools.
Okay.
So, yep.
So I need to know.
Right. What else gets affected because of red?
So literally so the state guideline says when you hit that 8% mark, KG, that just puts you red. That just says it's because the amount of cases in that 14-day window. So how the state figures it out, everybody, what your percentage is, you take your total cases in that Mark actually helped me with this one. You take your total cases in that 14-day period. So we had 22, you divide it by 14. You then divide that number by 19,293, that's our population, and then you multiply it by 100,000. That's how you get that number.
Okay.
All right.
And I thought that last night you said we were at 25. Where did?
So Amy, the initial count was 25, but then remember we transferred that we had that case in Idaho, and so that brought our number down because we transferred those cases out.
All right, I'm just going to jump back, Mark. I know that you were trying to say something. Sorry.
As a town.
AG, hold on one second. Sorry, Mark was waiting to say something.
So we can get Tom moving along. Tom was only on because he's in the office. He didn't know if anyone needed to know any of his updates with his COVID work in respect to his inspections. If not, Tom, I guess.
Thank you, Tom.
Thank you, Tom.
Thank you, Tom.
Thank you. Have a good night.
You too.
Tom.
Yeah. So the town doesn't require to take any action because of its red.
It does not. I mean, it's obviously something we need to look at. you know,
So
and-
just
yeah.
play more caution. That's all.
correct.
All right.
On the on the topic of the color-coded map, just another point to bring up with whatever we pushed out. I feel like the map itself is very misleading. That people for the past few weeks had thought, oh, we're green, we're yellow, this is great, everything's fine. As Ed and I are like, oh my God, all of these cases are building up. So just to reiterate to people, it really
Bless you.
doesn't mean anything. Bless you.
Allergies.
Not COVID.
Don't you feel like
So,
you have to yell, not COVID?
Always. Yeah, so it's just been very misleading and making it difficult, again, to give good information, because if I'm relaying this to people who are questioning me on, oh, well, how safe is it? It should be fine because we're whatever color. And I feel like now I'm going to be getting a lot of feedback. Oh my God, we're red. Yeah. Just maybe if we could put out something that explains better where that number comes from and what it means, and that it doesn't mean that the school closes, and it means
So
something.
maybe
So.
you could write something up for the town manager, Ed, to explain like why we shouldn't panic over the red.
I think we should give him something soon, because every Thursday he sends out a bulletin, so he could
Right.
include it
Yep.
in that.
Well, and I think, I think we should be proactive too and just have it ready either way, because especially if you're expecting it,
Yep.
All right, does anybody have anything else related to COVID?
The originator of this call was Mark Dasoni. I don't know whether he has anything about this Halloween.
Mark, will you enjoy your birthday?
I will, and
Happy birthday to you in
today?
advance. No, on October
Halloween.
3rd, Halloween.
Oh, happy birthday, Mark.
it's the mask that I wear every single day, so it's nothing new to wear one. And the costume is.
Stage handing out candy, Mark.
Were you a trick or a treat?
Well, when I came out of the hospital, the nurses, the doctor got scared and put me back in. And then when my mother's water broke, it came out squash.
Oh, God. All right, on that note,
Okay.
moving
Guys,
along.
I'm gonna pop off. I just have to go take care of dinner because I just got
See
home.
you later.
So,
Bye,
Awesome.
Amy. I'll
Thank
talk to you
Amy.
tomorrow.
Thank
Thank
you,
you.
Ed.
Thank you, Amy.
Thank you, Ed.
All right, Ed, do you have anything? You're welcome, obviously, to stay on the meeting, but do you have anything else?
I'm good unless anybody, you guys, you all know you can call me for anything. I always answer my phone.
Will
Thank
do.
you.
Thank you.
All right, Mark Oram, you are up. IMA for nursing services.
I'm just going to unmute. Okay, there we go. Good evening again, everyone. Just so everyone knows, as it relates to the IMA for the Public Health Nursing Services, at present, I got an update today from Barry Kepper from the Metropolitan Area Planning Council, and Hudson has approved the IMA, and the town of Holliston is reviewing it tonight, the Board of Health. So that was the Hudson Board of Health, and now the Holliston Board of Health's reviewing it. So they've offered to be at one of our meetings. I'd suggest maybe we put it on to invite them for a decision by the board at our next meeting, if that's the wish of the board.
Now, Mark, just to kind of go back a little ways. So I know that we had questions here, and I know obviously we've had emails, but are all of our questions and management questions
Well,
we're good? Like, and Lisa's, like, we're good? I just want to make sure that we take care of all of our internal questions before we have them on a meeting.
Sure. The service that they will provide is going to be based on what we pay. So obviously, if Hudson or Holliston, which they are paying less, they're going to get less services than Ashland will. Framingham will get more services because they're paying more than anyone. Unfortunately, they have not found a nurse. That's critical, no matter how many of us are involved with this. So that's critical. I would suggest that,
Did they plan on increasing the salary, or what's the next step for that?
They haven't said. I'm hoping that they will, but then if they do, we have to readjust what we can.
Well, that's, to be honest with you, that's I can't even remember what the questions were for the board at this point, and I apologize, but I have to tell you that that's one of my biggest concerns. Is it's been a good 5 months probably now that they've, and my thing is if they haven't got anything for the salary that they're advertising, clearly we need to increase the salary, because we want to get somebody who obviously is qualified. And they might not be in the right price range. So I think that's one big question on my list is like, what's your plan B? Because we could approve this, if we approve this agreement at the next meeting, it's still not going to take care of our needs. We don't have any staff.
That's a question that I have is, irrespective of whether Hudson gets this or that or whatever the money, but if you are spending X amount of dollars, are we getting the worth of information or the service that we need for our town? So do we have a list of tasks that we need to have done by a nurse?
They have noted the primary services provided by the nurse will be to do blood pressure clinics, overseeing the number one part of the job will be overseeing communicable disease and reporting. So that's the number one part of it. The secondary is the community outreach, such as blood pressure clinics and so forth. Outside of that, they have indicated as we're in one right now, if it's a pandemic, this nurse could not actually do that work. As we understand, we have several nurses trying to help us out right now. So that was written into the agreement that they could not offer pandemic nursing services if it occurs again. So that's one of the services they cannot, but that's pretty much what the nurse will offer. Some community outreach is secondary to the primary, which is communicable disease reporting.
So if the board wants, I know we're going to talk about our next meeting schedule. I mean, we could have, it would be Barry from MAPC, right, Mark, that would attend our meeting?
Yes,
I mean, we could have Barry attend our meeting. I just want to make sure, if the board feels it's necessary, we can have him come in front of the board and go over it. I mean, I know Mark has presented this every meeting to us.
He's offering that, and I'd suggest it just so that you have that resource. They received funding from the grant to be our resource, so I'd suggest it, Diane, that we invite Barry to the next.
And
no, this is waiting on the Board of Health. Next step will be then to send it to the selectmen. Okay. I haven't seen anything from Lisa to say she's satisfied with it.
Yeah, did you say? Is it in her hand or is it?
It was sent out. I have to go check.
Okay, that's fine. Okay. So I guess for the board, if everybody's okay with it, we'll have Barry come to the next meeting and just do an overview. We'll have him on right after. Maybe I'll put him on before COVID. We'll see, but we can have him on at our next meeting to just do an overview, so the board can make a decision, and then maybe if people have questions, we can get them answered.
I have a couple of questions on that services that we talked about. We said blood pressure clinic. Are we doing it now, as of now, or we are not doing it because we don't have a nurse who can do that?
Well, we could be doing it, but again, it's one of those, if time allows, that, our proportion, then community outreach and blood pressure clinics for the elderly is one of the examples.
There are two different aspects of it, right? One is the blood pressure clinic. The other one is the community reach out. They're two independent ones. They're not together.
No, they're not. The community outreach is having pressure.
We're not doing it currently. Our current nurse is doing communicable disease.
Who would get the service of blood pressure clinic? Is only the seniors, or you're talking about somebody who has had issues with blood pressure?
It could be anyone. The typical process is to set it up at your elderly community center, but it's a community center, so I don't think they would say no to someone that walked in that wasn't elderly. Also, like medicine adherence is another opportunity for community outreach, and typically that's with the elderly population. So a good portion of your community outreach would be with the elderly population, but I would expect, if time allows and if there's enough time to do other community outreach, that we work with our school nurses to see what other programs could be helpful, decisions at every turn, projects like that, tobacco control. There's so many opportunities for community outreach.
Right, that's the different. I'm just only concentrating on the blood pressure thing, but right now, because of the COVID situation, this may not be a viable thing to do, even offer it, because people may not come and use it because.
Well, the clinic is open in Framingham. From what I understand, it's open for services now. Okay. So if, say, there's someone of whatever age group that's monitoring their blood pressure and wanted to stop in there, weekly, whatever the case may be, to get their blood pressure done. I mean, those were services. My understanding is that the clinic would be open for our residents to go there and get a vaccination or get a blood pressure, or, if they had, obviously, if they have a communicable disease, they would get, full service as well.
Okay.
Are they closed right now, Diane, the clinic?
As far as I know, I mean, Mark, I don't know if you've heard anything. As far as I know, one of the meetings that I went to, they were opening back up. I believe it was beginning of October, but I have not personally gone. I just can't. I haven't gone by
Yes, most doctors' offices are all doing telehealth unless we insist on personal seeing. So the clinics.
I know that. Yeah, in general, I mean, I know from experiences they are doing actual appointments as well.
No, yeah, I know.
As far as I knew, and I'm assuming it's by appointment only, maybe
Right.
at this point, just like even the town hall.
Okay.
Anybody have any questions about the IMA? If not, we can ask Barry to come to our next meeting. Okay.
His coming should not depend on our questions anyway.
No, I just wanted to make sure, because if there's any questions that we want to make sure that we get answered, I just want to make sure that we're
Right.
Okay.
Thank you.
All right, Mark, the budget FY21.
Yeah, magically, somehow, and unfortunately, I didn't have time to check into it. Our permanent position budget has changed from our last budget that we received back.
So I apologize, the report options are not correct in this. This budget, again, is from 2019, so that's why it's.
Yeah, no, I that's why I'm going off the October 2nd, 2020 budget.
So the, Laura's expressing, so that, Laura, so Mark, if you look up on the left-hand corner, it's okay, it says this is for 2019 one. So that means it's for January of 2019. So
I always forget to change those numbers when I do the report.
System thing, but so that's why the figures aren't going to look right.
So I don't know if anyone has the budget from the last meeting, but
it wasn't correct, Mark. I'm sorry.
Yeah, and so that budget there can be updated.
Promise next time.
That's okay. We can work on it tomorrow, Laura.
Yes, we go over it the next time. And then, as I mentioned before, we're trying to correct the line items with the nurse.
Yeah, yes. As soon as you correct it, you can email them too. It doesn't matter.
Sure, exactly.
Good idea, KJ.
Perfect idea. We'll do
So
that.
you'd like to work with you, Laura, tomorrow, and then you can send it back out to the board.
Yeah, I know. I know when you do the report options, you have to do 20. You have to do FY20. Change that, and I think it just comes up as.
You have to do FY21, and they change
21, right?
Okay,
all right.
we can send that out. And then anyone that has questions, they can call me by all means, reach out to me. The Medical Reserve Corps, thank you, Laura, for sending out the request for training that's available. You should all have that in your packets. There's several opportunities for training. Some of them, like Stop the Bleed and CPR right now with the situation with the pandemic, are limited. So, but there's others that if the board so requests to have training, just got to notify them and fill out forms 30 days prior to that event, and we could offer that type of training to our Medical Reserve Corps.
Yeah, Laura, if you can find out if there's anything available now, I'm assuming it would be virtual, that maybe we could send out to our active members that they could, even if it's a video on something.
Yeah.
Keep everybody in.
Basic shelter was one I was interested in. So
which one?
Okay. Basic shelter.
Sheltering. That's what I was trying to tell you today, Judy, when I saw you sheltering.
But that might be good, especially if, I mean, even if it's some, for some of the newer members, that are, or the ones that are.
I've heard we're supposed to get a terrible winter.
Warming centers.
Yeah, she said she just needs 30 days notice or so. So we can try and set that up.
You could do the shelter training in a shelter.
It might have to be that, right?
I guess so.
But I'm wondering, is it something Diane or Laura, I don't know who can answer it, that, we could just get a bunch of us say, we all would like this and this, and like set up a couple of virtual things with whoever's the teacher. And then if they agree, say, how many other people can we invite?
She said you can invite up to 100.
Oh, they may even have a video of these things, tutorials.
That's what I was thinking, if we actually had a actual like a video, if you will, that we could send out.
They
for
can do it
people-
at their own convenient time whenever they want. They don't have to give a
Yeah.
30-day notice for this.
And I do agree, like, I think that if there was an interactive one, that would be good. So I mean, if we can find out like what's actually available either way, Laura, that would be great as
Mhm.
well. Then we can maybe push some of that out now.
Yeah.
Yep.
If its video is available, send it out now, and maybe afterwards, if they won't have an interactive one, they can have another
Right.
one. So
Right.
All right, well, thank you for that. Anything else, Mark, on that Medical Reserve Corps?
Oh, that's an excellent start, I think, is
Yep.
to get these trainings out there so our group can stay active.
All right, and I apologize, I was a little bit late. I appreciate Chris starting the meeting. I did hear him say about the date of the meeting is October 6th, not October 3rd, which is listed on the agenda.
Right. The date's right on the minutes, but it's just not right on the
Yeah,
agenda.
to me, that's a housekeeping, and I'll make the decision that we can go ahead and approve the minutes. That's a housekeeping. So that shouldn't be any type of a violation.
Right.
If anybody feels otherwise, we can leave it for the next meeting, but anybody feel otherwise? Everybody comfortable?
comfortable.
Okay, so do I hear a motion for approval of the 3 sets of minutes?
Yes, so moved.
I'll make that motion.
Okay.
I made it already. You
All
need
right,
to
Ron-
second that.
Okay, I'll second KG's motion.
Thank you,
Good.
Ron.
Thank you.
All in favor?
Aye.
Aye, Chris.
Aye,
Aye.
Diane.
Hi, KG.
You win, Judy? Did you?
Was that a meeting for last week, or I wasn't there last week?
Oh, as long as you've read the meetings and then observed the video, you can vote for it.
I'm not going to vote for last week.
Right.
Was
So
that
you
Okay.
want to, you want
Okay,
to
that's
split
fine.
that
So you
was the last
abstained
one.
from the,
motion?
And then Chris wasn't at the one before that. So I think,
so being on a board, you can approve the minutes
Right.
because
I
you're
haven't read
approving.
them.
Yeah, oh, no, that's fine. But I'm just saying you can approve the minutes as context, even if you weren't physically at the meeting.
Okay.
And I respect that. I have done that myself.
Yeah.
Have abstained because I haven't been there. So Judy, you want to abstain from the October 6th, correct?
Yes.
No, you can't do it individually. You have to do it together or not, because this is a vote on 3 minutes.
Okay,
Unless you want
so-
to split that, you want me to split it and then do it.
Sure.
That
That would be great.
okay. Which was the October 3rd was the one that you don't
October
want to
6th.
correct? All
October
right,
6th.
October 6th. Okay. I move that the October 6th minutes as presented be approved. Somebody
And
needs to second that.
Do I have a second? Ron, thank you. All in favor? Aye, Diane.
Aye, Chris.
Hi, KG.
Okay, and Judy.
And then I
abstained.
move that the August 18th and September 15th minutes as presented be approved.
I second that.
You okay
And
with that, Chris?
Chris, are you good with that? You were not at the August
Yep.
18th. Okay.
That's fine. I
Okay.
approve it.
Okay, second, thank you. All in favor?
Hi,
Aye.
KG.
Aye,
Aye,
Chris.
Diane.
And
Thank you
Judy.
for that.
All right.
All right, so I'm glad Mark's looking ahead because the 3rd is the election, so we will not be meeting. Mark, I believe we talked about maybe meeting the 17th because it breaks up the month a little bit. We have a couple of holidays in the month of November. So if everybody's okay, I was thinking
fine.
we'd meet on November 17th and just have one meeting next month.
That's fine.
We'll do 6 p.m. We'll ask, and we'll keep Mark's regular items, it's reoccurring, and we'll put the MAPC for the IMA on towards the beginning of the meeting.
Okay.
Anybody else have anything else for the next meeting?
Oh, next meeting. If we can get to the Roberts Hill well issue, that'll be nice. I don't know whether the well quality, the water quality has been approved or not approved. We don't know yet. Mark, if he has any update, then he can present it to us. The other thing is that I also need to get a copy of the permit that was given to them. If you can get me a copy, that'll be nice, Mark.
I
And
know Mark had sent it to us sometime ago. I mean, it was a while ago.
to you, probably not to me.
Okay, I have to honestly have to look back.
Yeah. The other thing that I was on a conservation commission site survey Friday, and then Friday or Sunday, and then we were observing some leftover tires, and I've already sent pictures and the notification to Mark Horam to take care of it because
Okay.
there is stagnant water in it, even though mosquito is not big issue this year now, it might continue to be the issue when it comes next year. And if the tires are still there like that, there'll be a problem. There are about 20 or 30 tires, they're huge ones.
And I know I'm just kind of jumping in here for you, Mark, but I'm sure Mark can handle that outside of a meeting. But
sure,
if Mark feels that we need to bring them into our next meeting, of course we can.
But just to keep the board members informed of what happened when I was in Conservation Commission. I'm keeping an eye on the Board of Health issues at that point.
Thank you. We appreciate that. So I do have to ask, I don't know if anybody else saw the email. It came in shortly before our meeting.
I know. I was just about to make a comment on that.
So,
I haven't seen it yet. So how much?
So we got an email from Tom Curran telling us there's an establishment that did not pass inspection and they were fined this evening. We have not notified them to be on our meeting.
Okay.
It may constitute us having a quick meeting sooner than later.
Sure.
I will just want to let people know, I will reach out to Tom and talk to Mark off camera and review this because I did not.
When was this, Diane?
Tom sent an email at 5:36 p.m.
So I think that was a
public information. It's about King BB's. They failed an inspection.
No, I think the old inspection, the fine was paid.
Yes.
Yeah.
But is this the same inspection?
Yes.
From back when?
It's a
the old one. That's why I sent an email to Tom afterwards saying that.
Okay.
Make sure you change.
Make
sure change the subject line when he's replying back.
Well, thank you. I'm glad you clarified that because I'm looking at it going, we might have to have a meeting if they. Okay.
Right.
No.
I thought you meant a different email, Diane.
I also thought so.
Okay.
Was there anything else, Chris?
Well, there's some buzz around a cell phone tower situation in town.
Oh.
And there's only one person I've ever heard any concerns about cell phone towers from, who has spoken at our meetings several times.
Right.
There's no request from the Board of Health, but you'll see an email that went to the Board of Selectmen. Excuse me, the Select Board. That referred to us.
Yeah, and it actually complimented us because we've had multiple meetings.
Yeah.
To listen, and I think that it's Cece Doucette. I mean, Cece Doucette wants to go in front of the Select Board and do a presentation because the Select Board is because they own the town properties, they have a right to, or they sign contracts with people for cell towers. So trying to get, I'll call it some airtime at the Select Board's meeting. So that's what.
But it also mentions that we haven't taken any action. So I'm wondering if we should at least put on the agenda that we haven't taken any action because there isn't any action for us to take. That we don't hold a specific position on the topic at this point. I think that, I think it's, I don't know how we feel individually. Maybe we want to have a short discussion on how each of us individually feel to maybe form a more accurate board description. Personally, the science I've seen indicates that there isn't really any danger. But that may not be what everybody feels, and some people may feel differently. But maybe we can say, let's allocate X amount of time to having people talk about it if it's something they want to discuss, how they feel about it, so that we can think about where in the future, if we do want to make a statement, this is the Board of Health's current stance on the policy, or if we want to abstain from making a statement or taking any action until such a point. But I think it's important at least that we have a discussion amongst ourselves to see how we feel as a board.
No, besides that, we don't know what kind of authority we have to take what actions.
Exactly.
So, and again, I just opened up my email, so I apologize. I'm just looking to the side. There's some type of a meeting tonight at 7:15, so I don't know if anybody wants to log on to their email and check that out. I do not know which meeting is tonight. If you're interested in participating in that kind of a discussion tonight. And what we can do is just put it on the agenda, like I said, to find out what our authority is and make a general statement. If you want. So, okay, I'll
include that the next meeting.
All right. Anybody have anything else for the next meeting?
And then if there is any change in the situation with COVID conditions and we have to meet in between, we should be able to meet it.
Well, I think we've always gone on that. I think we've gone on the, where scheduled meetings are the first and third Tuesday of every month. But
Right.
should there be a public health emergency situation or something that a bylaw requires us to meet in
Sure.
between, that we're always willing to do so.
All right.
I'm just going to pop in. So Halloween's going to take place in the middle. We agreed, I'm just trying to recap. We agreed that Ed was going to put together something about Halloween safety and get it out to the streets.
Yep.
I'm gonna work, yeah, actually, I'm gonna get that, yeah, I'll get that out to Beth and Ashley too, to get something.
And then the second thing is I'm going to send the questions that Kitty, Ed, and I have come up with so far, and I'll include Amy's on that. But in the meantime, I'm going to try to take them and put them together, and then I'll send them out again to everybody, because I think to wait until mid-November to get it out would probably be too long.
Thank you for that. I appreciate that.
Okay.
While we were talking about the Halloween stuff, I took a personal initiative, not that it had anything to do with my role on the board, but I did post to the Real Ashland Mass Bulletin Board that I manage on Facebook, the link to the COVID page, the Ashland COVID page, and to the DPH Tips for Healthy Halloween, and
Great.
would be happy to, on a personal level, share any information that the board wants to share on that site.
That's what I was going to ask you. So you would be willing to, like, the questions
Absolutely.
and answers, and okay,
Yeah.
that would be awesome, because I
Yeah.
mean, I think any help, even personally, if we can just keep sharing the information
Mhm.
with people.
Right.
Thank you for that.
Thank you.
And I will ask Jim Adams to push something out also to the students.
Okay. Ron, were you going to ask something?
It's just for Mark. Not that I want to pile more stuff on you, but when we have that discussion about the cell towers, can you at least give a brief overview of what the actual jurisdiction of the Board of Health is? So that's laid out there. You probably know that, and I know I don't.
It's very limited, but I'd be glad to. It's
Yeah, just so it sets the tone so that we can make some kind of cohesive statement that tells people we're not ignoring it, but this is what legally our jurisdiction is.
Yeah, FCC controls most of it.
Yeah. Does MAHB have anything
I'm not
on this
sure
one?
about that, but I've dealt with.
I don't think she ever presented to MAHB gatherings, did she?
Gatherings or cell towers?
No, on this topic, has MAHB
Excuse me.
said anything on it?
That I'm not for sure, but I can look into that, KG.
Talk to maybe to our attorney there, and then maybe she may have some information.
The WHO has released information about it.
Yeah, but
Yeah, and if you get any information, maybe just, send it to us ahead of time for us to take a peek at before the meeting.
most of the towns rely upon the MAHB's template on regulations. They work with the template, they come back with it, and they discuss this and then make up one with the MAHB, and then Cheryl Sabaro and others are involved in it. So if they have anything, then it may be easier to work with and then put a regulations or take control of the item. If there is no recommendation from them, we may not be able to regulate anything here.
Yeah, the only thing I know of is I think it's part of the zoning bylaws in terms of distance.
What I was going to say, I just don't want to get too much into a discussion about it, just in case. But so why don't we put it on the agenda for the next meeting, and if Mark can just gather some information, and Mark, like I said, if you have it ahead of time, you can send it, and then we can review it, as a board at the next meeting. And even if we don't have any jurisdictions, maybe we can make a statement. So thanks for bringing that up.
That's a great idea.
Yeah. Anybody have anything else?
I would like to make a motion.
Would you? What would your motion be, Judy?
To adjourn.
I second that gladly.
Thank you.
Thank you.
All in favor?
Hi, KG.
Hi, Chris.
Aye. 7:19 p.m.
Sure.
All right. Thanks everybody
Yeah.
for your effort. Have
Thank
a good
you.
night.
Take
Yeah.
care, everyone.
Bye-bye.
Okay. Bye-bye.